Cool. Welcome to the first webinar on the new normal series done by team Momentro. I'll give you a quick intro into Momentro. Just get out of the way with the marketing work. So we are a marketing technology company based in Malaysia, and we look at 6 key things for our clients, from marketing funnels, funnel optimization, marketing technology, content strategy, training, and precision targeting work. Just a bit about myself. So I'm Saliya. I'm the founder of Momentro, and been in marketing for the last 20 plus years, and won a couple of awards as well. So the main passion is actually to improve marketing funnels and find ways to create more opportunities for brands. We have also developed a series of tools to help marketers to streamline their marketing as well as help them with their conversions. And also we work with a lot of global agencies that includes Weber Shandwick, McCann, Dentsu, and TBWA. We offer their clients a lot of support through our services. And finally, we work with a lot of global pharmaceutical brands, either directly or through our partners. And we have helped these brands to, one thing is speak to their customers in a very conversion focused way, and also to help educate their customers a little bit. We also provide the traditional digital parts, which includes SEO, SEM, creative, that kind of thing. And we have worked with a lot of technologies that includes blockchain, analytics, AdWords, and whatnot. So on that note, what I'll do is I'll start off with the session. So I guess most of you would have heard the term new normal. I think it's overused, and I think we want actions now. We want to know what's happening. We want to find out ways to improve our marketing. So that's where Momentro thought, okay, start with the pharmaceutical sector, find out how the pharma marketers can improve, plus how can they use data in order to get to that state where they are very comfortable with the marketing funnel, and also how do they use new channels to market based on these new changes. First things first, how do you move beyond the tried and tested channels? So you need to make sense of the new channels that are out there, especially when you need to go to market. Did you know that according to a research done recently, there is about 90% of people aged between 18 to 24, so your young millennials, they trust medical information on social media. So this fact alone proves that a lot of the young crowd are actually trusting what's on social. So with this in mind, what we have found out, which I'll take you through later on, is a lot of potential patients to customers and even the healthcare professionals are actually going online to get their educational fix. If you look at some of the Malaysian numbers for social and digital, most of our audiences here in Malaysia actually prefer to watch online videos, around 98%. They look at blogs, they listen to music via streaming services, they listen to online radio stations, podcasts. So there's these different types of content that keeps coming in. And Malaysia is actually in the forefront when it comes to consuming content online. So what did we do? We looked at some of the social media sentiments on channels such as Facebook, Instagram, Twitter. What we tried to do was we went into these particular pharmaceutical brand related pages and some of the course-based pages, and we tried to look at what potential patients, customers, healthcare professionals, what are they saying? So what you see on the left of this screen is actually some of the sentiments that we managed to get out of these social media pages. So for example, a lot of these are around symptoms, how to get vaccinated, what are the treatments that are available. So that's what's coming up a lot. A lot of the users actually commended and thanked some of these pages for sharing insightful information also. So which means people are actually making themselves aware of what's out there. And if you're in a very helpful angle and if you're creating that dialogue, you can actually win the hearts and minds of these potential customers, because there are certain issues that are stigmatized. And I think social media can really help educate people. So the data actually supports that. Another thing that we did was we actually tried to decipher some of the marketing intent. So if you think about Google search, it's a really good platform to understand what your potential customers or patients or healthcare professionals, what are they thinking? So the thinking patterns can be deciphered through Google search. So our data actually has revealed that the pharmaceutical related clients are looking for information. For example, if you look at pre-COVID and post-COVID, we see a lot of searches going up for diseases. For example, pneumonia, cancer, diabetic symptoms, chemotherapy, HPV vaccine. What you see here as a number, for example, pneumonia, the growth has been 123% pre and post COVID. Most of these searches are coming from the Selangor region and followed by KL and also Johor, Penang, and Sarawak. So we actually see there's a massive growth when it comes to pre and post COVID Google search data for diseases. Another post-pandemic trend that we saw, especially in the pharmaceutical sector, was the 24-hour pharmacy near me, that type of searches. So a lot of people are trying to find out convenient ways of accessing pharma. So for example, what you see here is the average monthly searches for this type of keywords. What we mean by competition here is, as you know, Google operates similar to an auction system. So not a lot of brands are bidding on this type of keywords. So that's why it says low. But again, a post-pandemic trend here is about 24-hour pharmacy and that kind of thing. So just to conclude the Malaysian trends for Google search. So users actually began to search for online consultations options, especially post 2019. There's a lot of searches happening for medical deliveries, nearest pharmacies, that kind of term. And then there are some newly emerging trends and patterns in consumer behavior, which I'll talk to you about later. And also, we can figure out what kind of digital content to create based on this search data. So that's where this data is very important. And also, this post-pandemic, or actually the pandemic scenario, has opened up a lot of social channels for us, even for new segments of the market. You guys are very much aware of the regulation side of things. I don't think I need to harp on that too much. But according to the MAB, if you are creating any online or offline material, you need to go through an approval process. Unless you're in the food, cosmetics, and medical devices fields, you are self-regulated, but still it is regulated. So we actually operate in a very much of a regulated industry. So how do you actually use digital in this space? So that's what we need to look at, especially with data. There is a concept called cost-based marketing. This is a way out to a certain extent when it comes to looking at using digital to market. As we found out earlier, there's a lot of people who are looking for information. They are hungry for information, and what we can do is we can feed this hunger for education. So, we need to focus on educating people on a cause rather than selling a product. This is what will get us out of this space right now. One such way is actually to create a proxy to promote a cause. So, for example, if you have come across a trend, a disease, or something that you support, or something that you advocate through your products and services, we need to look at that. And what we are seeing more and more is a lot of pharmaceutical organizations are standing behind the disease that they represent in an effort to actually raise awareness. And there is a lot of industry-wide resources that you have access to. There's a lot of networks that pharmaceutical companies have access to. So this can actually help drive this social awareness and change that people are looking for. So using a proxy for your marketing efforts is actually a very good way to get your message across. Let's look at some of the content that's working really well. One of the things that we are seeing post COVID is actually virtual summits. This is actually from Johnson & Johnson. They are having a virtual summit called Spine Time. And it's something that they've been promoting quite a lot. So again, the target audience here has been the HCPs or the healthcare professionals, not the end user per se. But again, it's a very good way of engaging with your channel partners. Another area is webinars and peer-to-peer meetups. So we are seeing this happening a lot more. According to a study done recently, 72% of the physicians source drug-related information online, and 78% of physicians actually favor learning through video or digital media. So this itself is a good insight for us to create more digital content that can be consumed not only by our customers, but actually by our channel or our partners. So this is another trend that's coming up in pharma. So we are also seeing a lot of e-learning that is being advocated. Actually, e-learning is one of the highest searched terms during and post-COVID, because I think given the distancing rules, a lot of the people out there want to digitize their learning. So this is actually a portal that we built for Invisalign in Singapore, where we help them to create this portal to help educate their practice for e-learning. And this portal is now being translated into 14 countries in Southeast Asia. So it's actually a trend that we see that's growing a lot. Another type of content is actually Facebook Live and Instagram Live with key opinion leaders. So for example, if you have a set of opinion leaders that you actually use to disseminate your messaging, you can do FB and IG Live. LinkedIn also has that option now, where you can actually talk to a wider audience and create a platform using these influencers and combining the social media channels. We are also seeing tech being involved a lot, especially augmented reality or AR. We are seeing AR being used in pharma to create product demos, to educate patients, to enable sales, even for conferences, where you can actually see a lot of these things in a very natural kind of way. So augmented reality is being used more right now. There is another concept called digital collaborations that we have come up with. So these are actually coalitions with partners who actually have a say in what you want to say. For example, you have your brand, you might be a pharmaceutical brand. What you do is you liaise with a third-party organization who also represents the disease that you actually stand behind. And then what you can do is, together with that third-party organization and with influencers, you can formulate a digital collaboration or a coalition. So, for example, you are a brand that promotes awareness about any thoracic disorders. So you partner with the Malaysian Thoracic Society, and maybe you can connect with influencers who are in that space. Similarly, You can be a brand that promotes psoriasis related communication. Then you partner with the Malaysian Society or the Dermatological Society of Malaysia, and you partner with different doctors or skin specialists. So it's a collaboration between the individuals who are your influencers and these third party organizations. Because the moment this kind of messaging goes out to third parties, the credibility for you as a brand also goes up, because it's not just you trying to promote this. So this is another trend that we are seeing right now. Influencer marketing, I mean, you would have heard about the term key opinion leaders, but now we are more and more moving towards the micro opinion leaders, because obviously the key opinion leaders are more or less like the celebrities out there. You know, they endorse a lot of things, whereas the micro opinion leaders, even though their followers may be less, even though their reach may be less, they reach the right people, and the influence they have actually is much more, because the trustability is much more. People know that they are not just promoting something. So this is where I think the pharma marketers can really look at influencer marketing and how to work with these influencers, especially to give that information people are asking for. So here's basically 3 ways to engage with your influencers, and how you can actually get a massive bang for the buck that you're spending. For example, you can create joint video content educating patients about information that they are seeking. So you can do these collaborations with the micro opinion leaders. You can do paid social campaigns as well, where it can be a popular day, the World Cancer Day, or whatnot. So you can take that day, do a paid social campaign together with these influencers, raise awareness. And finally, you can do online events such as webinars, social media tweet jams, that kind of work, so that you can attract these. You can actually use the influencers to attract potential customers. So these are 3 things that we recommend doing, especially with your influencers. Another area that we tend to forget sometimes is, when you have a platform or a website, there are things that you can do to test whether you're getting the right people and whether they are performing the right actions. Especially when you start running digital campaigns using Facebook or Google, you start getting a lot of traffic. So there are different tools. Now what I've done here is put an example from Google Optimize. This is actually a feature within Google Analytics, where you can start doing A/B tests within your site to see whether, one example could be, you have patient stories, whether a local patient story works, or whether a celebrity version of that works. Or if you want to change the page name to attract more organic visitors. So there are tons of stuff you can do. So if you're currently not using tools such as Google Optimize, or even heat mapping tools to identify where or what people are doing on your website, start looking at it now, because that's very important. Another area that you can look at, especially when you do your social media campaigns, don't just blanket target everybody. There are options to geofence. Again, don't just geofence, but look at how you can use that geofence to support your ground sales reps. For example, if your reps are targeting healthcare professionals in a certain area within a certain time period of the month, what you can do as a digital marketer or a marketer, you can geofence that area and start promoting content around your brand. So the moment your sales reps go to meet the HCPs are already aware of what they're going to talk about. That will really help these guys. So integrate your campaigns, use geofencing, and use that for your advantage. Another thing that we can do is, there's an option called custom audiences, especially on Facebook and LinkedIn. This is a feature that's been there for a while, but what you can do is combine this with your goal completions on Google Analytics. Let me explain that a little bit. So once you start driving traffic to a landing page or a website, you you need to know which ones are actually the important ones, which ones are performing the actions you want them to perform, and how to get more people like that. There's a tool called remarketing that you can use. So basically how you do that is Facebook has a piece of code or a pixel. It's a JavaScript code. You put it on your website. On Google Analytics, you have these things called goals. So for example, if you want people to visit a clinic or find a clinic or talk to a doctor, that is a goal within your website. So the moment somebody clicks that, that means that's the ideal type of traffic you need. Because in pharmaceutical marketing, you can't get their personal data. You can't ask who they are. You know, that's against the privacy laws that are out there. So this is another different way of targeting the right people. So as I said, somebody who completes the goal, you can target people similar to that via your social media pages or your LinkedIn. So that's the beauty of combining your customer audiences with your goal completions. Um, in general, what I wanted to mainly say is, we as pharmaceutical marketers, we used to do big launches. Our marketing playbook was full of big launches. You know, we would do a PR campaign, we might do an event, get influencers to come. But with post-COVID and also moving forward, one is your budgets are going to be restricted. And the other area is you can't do a lot of physical event type of stuff. So throw away that big bang launch. What you need to have is an always on digital approach. Because if you don't have an always on digital approach, you will not be able to speak to your audience at the time they want to know information. So that's why you need to combine your email, social, your search, remarketing together to target this audience, get them to come to one of your pages or one of your landing pages or one of your course or disease-based pages. Once they are there, then you start optimizing using CRM and also different dashboards for data. So that is how you stagger your marketing, and that's how you actually optimize your marketing funnel moving forward. So again, the key takeaway is get rid of that big bang. You know, that's not going to happen. That's not practical. Try and always have an always on approach. That's what's going to get you the right visitors coming into the content that you're creating. So that's about it from us for today. So if you have any questions, please feel free to fire now. If not, what we'll do is we will share this recording with everybody. And then based on that, you can engage with us. Thank you. I'll just wait for maybe another 5-10 minutes, see whether there are any questions coming in. If not, we can conclude the session.